An estimated 285 million people worldwide are affected by diabetes, with estimates suggesting that this will rise to 438 million people by 2030. In Canada, more than 9 million people live with diabetes or prediabetes, a condition where a person's blood glucose levels are higher than normal, but not yet high enough for a diagnosis of type 2 diabetes. If left untreated, diabetes can lead to serious health problems. But for many people, diabetes and its complications can be prevented or delayed by understanding risk factors and making important dietary and lifestyle changes. There are actually 3 types of diabetes: type 1, type 2, and gestational diabetes, in addition to prediabetes. To understand these conditions, we have to first understand the role of insulin in the body. Insulin is a hormone that controls the amount of glucose, a form of sugar, in the blood. Without enough insulin, glucose can't enter our cells to be used as energy. Type 1 diabetes is usually diagnosed in children and adolescents and is a disease that occurs when the pancreas is unable to produce insulin. Approximately 10% of people with diabetes have type 1 diabetes, and this condition can arise as a result of the body attacking its own insulin-producing cells, making it an autoimmune disease. Type 2 diabetes occurs when the pancreas does not produce enough insulin or when the body does not effectively use the insulin that is produced. The latter is known as insulin resistance and can arise due to excess body fat and other factors. Type 2 diabetes usually develops in adulthood, although increasing numbers of children in high-risk populations are being diagnosed. Type 2 diabetes accounts for 90% of people with the condition. Gestational diabetes is the third form of diabetes and is usually a temporary condition that occurs during pregnancy. It affects approximately 2 to 4% of all pregnancies, although rates are higher in First Nations populations. Gestational diabetes is associated with an increased risk of both mother and child later developing diabetes.